I'm Tim Kelcher with your Catholic Health Update for the week of June 29th. A new show highlighting the clinical excellence and compassionate care of Catholic health has made its debut. Conversations in Care premiered on CBS and the Catholic Faith Network recently. The show was hosted by CFN's Colleen McVeigh and features studio interviews with Catholic health experts as well as field segments and patient stories showcasing the best of what Catholic health has to offer. The first show focused on Catholic Health's dementia and Alzheimer's program.
Over the past 3 to 4 years, the FDA has approved 3, and now they're only using 2 of these monoclonal antibodies, which are infusions. After the infusion is complete, you go home, and that's the end of the story until the next cycle.
It's not a cure.
What it does is it slows down the cognitive decline in patients with Alzheimer's disease.
June is Uterine Cancer Awareness Month, with the most common being endometrial cancer. Most often, endometrial cancer is related to postmenopausal bleeding and excess levels of estrogen in the body. Catholic Health Chief of Gynecologic Oncology, Dr. Jen McEachran, shared some treatment options available at Catholic Health.
Typically, when we find endometrial cancer at early stages, the cancer is treated with surgery. In most cases, women are diagnosed very early. In advanced cases, some women do require chemotherapy or radiation or a combination of both, and these are all things that we offer at Catholic Health.
And finally today, a great story about a local bus driver. This is 72-year-old Robert Clark. He was diagnosed with what he thought was a scratch on his finger, but by the time he arrived at St. Joseph Hospital, he was at risk of amputation. However, after 2 months of HBO2 therapy and advanced wound treatments, he made a complete recovery. A wonderful outcome, and we wish Robert a continued recovery. For more great stories just like this, head over to our website. It's catholichealthli.org. With your Catholic Health Update, I'm Tim Kelchner.